It's 9:03. This is Denise Grimm with the Michigan Asian Pacific American Affairs Commission. I will be the organizer and handling the chat box. So we're going to start our program now, and I'd like to turn it over to the MAPAC chair, Toshiki Masaki. Thank you.
Hi, good morning, everyone, and welcome to Preparedness of Operating Your Business During the Pandemic, hosted by Michigan Asian Pacific American Commission, or MAPAC, and Department of Labor Opportunities Office, Michigan. Like Denise said, my name is Toshiki Masaki, chair of MAPAC, and we are very pleased to be co-hosting this event. I'd like to inform you that the entire proceeding will be recorded, and the recording will be made available on MAPAC's Facebook page later. I know many of you are familiar with MAPAC, but for those of you who are not, it consists of 21 governor-appointed commissioners representing various Asia-Pacific communities throughout the state. The commissioner's primary objective is to be the conduit between the state and the representative communities respective communities represent, by being eyes and ears for the needs and concerns of our communities and communicating those to the state's attention, as well as informing our communities of various resources the state offers to all its residents. We have our own website, www.michigan.gov/MAPAC, and also a Facebook page where you can find detailed information about the Commission's activities as well as events we sponsor, such as this. Link to these websites. Ferouz Saad, the Executive Director of Office of Global Michigan. Welcome once again.
Thank you, Toshiki. Good morning, everyone. Thank you for joining us this morning. This is one in a series of these that we're doing, Myosha's doing, Sean, who's the Deputy Director at Leo, is doing, and so getting this information to you all is really important and priority for a number of reasons that I'm sure you know because you're here with us today, and that certainly you'll learn even more as the presentation goes on. So some quick background on the Office of Global Michigan. For those of you that don't know, again, my name is Ferouz Saad. I'm the director of the Office of Global Michigan, which essentially is the lead office for the governor to lead on policies and programs that affect immigrant, new American, refugee, our global community. And so we work on a number of issues and programs across state government to ensure that the communities that we serve are getting the help, services, and guidance that they need from the state of Michigan on a number of things, but during this pandemic, especially on the issues that will affect public health and safety. We have been working really hard to ensure that needed materials are translated into a number of different languages. These include the governor's executive orders, press release. Myosha has documents that they've translated as well. And so, and this is an ongoing effort. So as you all see information and out there that you think is valuable and needs to get to your communities that you think would help from being translated. Now, we can't translate everything, so I don't want to overpromise, but we'll certainly work with you all to make sure at least the most important and critical materials are. Please, you're always welcome to reach out to myself, but work through your partners at MAPAC, Denise, Toshiki, and your commissioners who are here to serve you. So within the Office of Global Michigan, just so you know, are our 3 ethnic commissions, which includes MAPAC. Our other 2 commissions are the Commission on Middle Eastern American Affairs and the Hispanic Latino Commission. So with that, I'm going to pass it on to our speakers this morning. We have Sean Egan, who's a Deputy Director at Leo, and he has a new title with the governor as well, which I think he'll he'll probably have to let you all know because I apologize, I've forgotten it. And Lawrence Hidalgo, who is the Deputy Director at MIOSHA. So thank you to our speakers for being here. And Sean, I believe you're going first, so the floor is yours.
So thanks so much, Feiruz, for helping put this together, and certainly to Chairman Masaki for having us, and of course Lisa and Denise who did all the work. We really appreciate the opportunity to be here with you today and make sure we're getting this. We are working tirelessly, and with the help of Feiruz, that certainly impacts workplace safety, and somehow threading those needles and putting it all together are critical. As Feiruz mentioned, I'm the Deputy Director for named me as the Director of COVID Workplace Safety as well, across departments, across our communities, and connecting as much as we possibly can, because we know that all of you are committed to this, winning this battle against COVID and making sure that we can get open and stay open. I say that all the time, that, you know, if we follow the right path, if we use the tools, if we follow the orders, we can do this, but it's going to take a strong commitment from all of us. So, you know, I believe that we can do it if we do it smart and we do it right. So to ensure that all of you and every business and employee across the state of Michigan know what they should be doing, what resources are available, what tools are available, we have been working really, really hard at LEO. The folks at MIOSHA have been working day and night to make sure primarily through large respiratory droplets and aerosols that we create. We create those when we talk. We certainly create them when we cough and sneeze. You've seen that singing and yelling creates more of them, which we know, and that face coverings and social distancing are two of the primary tools that we can use to help prevent the transmission to others. And when we think of that, you know, there's different studies out there, but some 40% plus of people that are transmitting this virus will either be asymptomatic for the entire duration they have it, or they're pre-symptomatic. So these are folks that feel fine, that are going out and about thinking they may not need to wear a face covering because they feel fine, and they're actually pushing the spread of the virus. So we have some resources I'm going to cover, but I really strongly encourage you to take a look at Executive Order 115. Everybody in the state of Michigan is required to wear a face covering if they leave their home and go into a public space. We know, and we hear, and we talk with many of you, we know the challenges that you're seeing with getting your customers to comply, but you're going to have to stay strong and committed, because that's going to be the tool to get open and stay open. One of the other things that I'd like to point out, we do not have any specific requirements as it pertains to indoor air quality right now, other than consider, get more fresh air into your spaces, those types of things. There's no specific, you have to use this or do that. We have posted some technical guidance from ASHRAE, which is the gold standard in that space across the industry. It's a national organization of engineers and others that do specifically HVAC and air quality systems. They have posted some COVID-19 related guidance for across many industries. There's a lot of simple tools in there that you can use. ASHRAE, and certainly like hospitals, everybody's aware of, have very high standards of things that they need to be doing. Normally it's hard to find information for restaurants, bars, regular stores, those types of things, but they put that together. If you know what a MERV rating is, then you're as big of a dork as I am. A MERV rating is a rating on an air filter, and they have a suggestion on air filters of a MERV 13 or above. And when you think of filters, like HEPA is the top, right? A MERV rating of 13 is just a higher grade of air filter that they believe can help. There's some UV lighting and some other things, but we have that posted on our Michigan Leo main page. That's Michigan Labor and Economic Opportunity main page. We have a list of best practice guidelines that were created by many of you in those work groups, as well as the ASHRAE guidance. So I would encourage you to take a look at that. One of the things that I always bring up, but I don't spend a lot of time on, because I get this question a lot, especially in the business community, what is enforceable? So MIOSHA has been working tirelessly to develop tools, and from the beginning of this crisis, they have been using the general duty clause to enforce the CDC guidelines, and then as they came out later, the executive orders that you've seen posted on workplace safety issues. Obviously, MIOSHA doesn't have any regulatory authority over the public, but they certainly have, not absolute, but they have regulatory authority over all workplaces in Michigan, minus a very small list. Domestic workers, mines, and just a couple of others. But any place of employment, it's not one of those regulations that you've seen before where it's 15 or more employees or 50 or more employees. All places of employment in Michigan are covered by MIOSHA. So their goal is always to seek compliance before. That's their goal before, that's their goal now. And they've set up a lot of different resources that you can use to help do that. So we have a nice website that we've been developing over time, we've been updating over time. It's michigan.gov, COVID Workplace Safety. And I'll just take a brief look. I'll share my screen and just take a brief look at it. Oop, I clicked on the wrong thing. It moved on me. Sorry, everybody. Don't do that. So this website's specifically dedicated for MIOSHA created or approved materials, because we know that many employers want to know two things. What do I have to do? And then what are the next steps? So we've kept those best practice guidelines, which are awesome, as a next step directly on our Michigan Leo homepage. And then we've developed this site for the MIOSHA created guidance that includes guidance for every industry so far that's been specifically named in an executive order. And if your industry has not been named, we have general industry guidelines which apply across the board. So for these industries that you see, they all include those general industry pieces as well as the specific requirements for that type of industry. One of the coolest things that MIOSHA did right out of the gate is created this sample preparedness and response plan for low and medium risk employees. Now, OSHA established a hierarchy of categorizing workers based on risk, and it goes from very high to low. And very high and high risk categories are those that you would sort of expect. Those are more the hospitals, those folks that are going to be exposed to known or suspected cases of COVID. Very high is treating that person directly with treatments that may create aerosols, make them cough, things like that. High are people that are going to be directly exposed to those known or suspected cases. The vast majority of workplaces in Michigan are going to fall into the medium and low risk category. Medium are going to include places that are open to the public, where during community transmission, we don't know if they have it or not, but there's a lot of people hovering around. And then low are people that, construction was one of the first industries to open, because those folks are going to be on sites where there are typically not a lot of people. The public's never really coming in there, and you can really control the environment. MIOSHA also set up this wonderful hotline for COVID-specific questions. It's 855-SAFE-C19, and that's available for employees and employers to go to and ask any questions you have related to your workplace. And that goes directly to MIOSHA. The average wait time right now to get to somebody is about 10 seconds. The average call length is about 4.5 to 5 minutes, and it's working very, very well. Our complaint numbers have increased a lot because there's a lot of confusion around COVID, but the vast majority of employers are trying to comply. So we're getting 95+% compliance with the rules and expectations just by having conversations, or perhaps sending a letter or something like that. But it's mainly just small tweaks for the most part. You need to add this or do that, and it's working very, very well. So I would encourage you all to keep checking that out. We also have on there some posters you can use for those public places. I strongly encourage you to use that Executive Order 115, which allows you at this point to deny service. I know we do not want to create a bigger hazard. We are going to have folks that are just obstinate, they're not going to participate, and they're going to create a problem. We need to be careful. We do not want you or your workers out there putting themselves in harm's way with somebody that's just going to be that way. And we would encourage you, if you are declining service, to make sure you're ready to reach out to local authorities if you get into that situation. So we have one up there, and I've been saying it everywhere: no shirt, no shoes, no mask, no service. I'm claiming that I started it, but it's spreading across the country, and it's what we're going to need to do to make sure that we get open, stay open. We have videos that the team's created. There's some that are about 2.5 minutes for pretty much every industry that's on that list that just kind of touch on the high points. We have a talk over with the general industry guidelines that's directed at employers and employees presentation that you can use. That's great because it includes a lot of additional notes from the experts like Lawrence that are talking specifically from MIOSHA on what they're doing. We also have links on that site to the MEDC, which can get you to the Pure Michigan Business Connect platform. That is a platform specifically dedicated to Michigan manufactured PPE, sanitizer, plastic barriers, all of those things that you need to be thinking about and installing into your location. So, definitely get there. If you are a manufacturer, you can also try to connect there if you're making those types of products to get your name on that list. I've talked with MEDC a couple of times, and those manufacturers have capacity to provide products. So if you're struggling to find those things, go check out the Pure Michigan Business Connect, because that might be the connection that you need. And again, if you are manufacturing those, go there. As you know, the executive orders require a health screening. Lawrence, I won't step on his shoes, but Lawrence would tell you that in MIOSHA, the best thing that you can absolutely do is try to eliminate that hazard from the workplace. That's number one on the list. And certainly these health screenings, that's the goal, is to keep COVID out of the workplace. So all of those other mitigation measures we're taking, like face coverings, barriers, etc., have a much higher impact because we've identified and removed as much as possible. We know that we're still going to have people get sick at work. We know that it's possible that people are still going to make their way into work, but to the extent possible, we've removed that hazard from the workplace. And to help you do that, DHHS has a My Symptoms app, and this does comply. There's a little catch I'm going to explain, but this does comply with the health screening requirements in the executive orders. And what it does is, as an employer, you can go to the My Symptoms app. You set up an employer account. It'll give you an employer number that you give to your employees. They can use their smartphone, their desktop computer, or whatever else to set up their account. When you do that, you're going to set up who gets notified with the report. If there is a positive case, it will do a notification to the public health department. The flagged cases, like they've said, yes, they have one of the symptoms and they need to stay home, those don't get reported to public health. There's also, if they are flagged, whoever you set up as the contact point, it's going to give them an orange screen that says, you've identified that you may have one of these symptoms, do not go to work, call this person, whoever you said that was, and then hopefully that will happen. The goal would be, of course, to keep them from coming in before they do that, but we know that that's not always feasible, so you may have to be doing the screening at work. If you are, make sure you're watching those congregation points. We know that some folks are doing the temperature screens, which is awesome, but we don't want people lining up within 2 feet of each other waiting to get their temperatures checked, because that's not really going to help us accomplish what we want to accomplish. They're building a couple more tools into the My Symptoms app, because right now the report comes the day after, so the employee needs to show you their phone essentially that they're green, they're good to go. They're opening up a platform, it's in development, hopefully within a week or so, that you'll just be able to log in and see, and we're building some other tools around that. We know that there's a lot of vendors out there, so we really see the niche for this in those small employer space. It's free, it works, you can use it. The only caveat that I was going to mention is that in the executive order, for manufacturers specifically, it says that you do have to conduct a temperature screening when no-touch thermometers become available. I actually don't know how available those are yet, but if they are available, the health screening app can be the question screen part, but you'd still need to be doing that thermometer piece. In other locations, it's if possible, where possible, those types of things, so there's a little bit more flexibility for you there. And then lastly, I have two last points, and as you can tell, I can talk forever. I can just see Lawrence looking at me, so he's waiting to go. But in Senate Bill 690, we were provided about $8.55 million to MIOSHA to provide safety grants that are related to COVID. Now, MIOSHA is long run what we call a My Wish program, and in future years, I would tell you to check that out. It's for employers with 250 employees or less. I'm just going to talk about the COVID grants, not the My Wish one, but it's for 250 employees or less. We're going to try to kick this off on July 13th. The brochure and the application are done. You can't have outstanding penalties with MIOSHA. We're going to try to bucket the money a little bit because our normal one is about $250,000 a year, so we've obviously multiplied that by a very large number. We're going to try to bucket by industries for the first couple months to make sure that the money is dispersed sort of based on the number of businesses and employment in specific industries, which we just kind of feel is a little bit more fair. It's a matching grant of up to $10,000. It's for PPE, safety-related equipment, physical barriers, that kind of stuff, hand sanitizer, things you need to do for your business to create that safe workplace. And one of the questions that we got before is, can I buy face coverings for my customers? And as of now, yes, you can use it for that. Now, there is an evaluation. It's going to run mostly as a first-come, first-served process. So on July 13th, we're going to post a link right there on our COVID workplace site. Apply right away, but there's no deadline. We're going to keep giving out money until we run out of money. We don't know what to anticipate. It could be gone in a week. It could be gone in 3 months. After about the first month or so, when we get a good idea of where these grants are coming from, we will sort of get rid of the buckets and just put the remaining funds together and get them out the door. But we want to make sure that we're not kind of, just because people are quick, kind of allocating all the money in one direction. And then lastly, I would tell all of you, never ever forget about the great consultation team that they have over at MIOSHA. If you just Google MIOSHA and get to the homepage, right on the left-hand side, there's a consultation, education, and training link. And you can request a consultation. Could be by phone. These folks will come out and see you. It's a wonderful tool. They will help you with any questions that you might have about COVID, about what you can do in your workplace, and they will make it happen. And certainly all the field folks that are investigators and inspectors are very available and accommodating too, because we know that you're trying to do the right things. You just need help sometimes to know what those right things are. So that is our goal, to educate, consult. We do have the tool if we need it for enforcement and penalties, but that's not our primary goal. Our goal is to make sure that you're get in compliance and doing all the things that you can and should do to make sure you have a safe workplace. So I will stop there and turn it over to Lawrence, because I don't want to talk for the rest of the hour, and I appreciate it.
Really quick, Lawrence, sorry. Sean, if you don't mind putting some of those websites in the chats, we're getting a few questions. Like a true Michigander, you were talking really fast, but you promised to stay to 20 minutes as well, and so I appreciate you getting through all that. And then another question we're getting very quickly is if there's a POC within either each of your offices that people can connect with after that. So we can wait till after Lawrence speaks and see maybe who the right person is to contact. Lawrence, the floor is yours.
Thank you very much. And since half of my talk was covered already, mine will be really short. So thanks everyone for joining us. A little bit about MIOSHA. Federal OSHA oversees safety and health for workers. Each state can develop their own state plan, which Michigan has done, with the oversight of OSHA. and that's where we're at in Michigan. So our mission is to help to protect the safety and health of Michigan workers. We have 5 divisions. The one you really want to focus in, as Deputy Director Egan said, is the Consultation, Enforcement, and Training Division. We call it CET, C-E-T. They're not enforcement. They're there, and most of their services, almost all their services, are at no charge. And so their phone number is 517-284-7720. That's 517-284-7720. And that is really the number you want to use if you have any questions regarding COVID and what you need to do for your employees. We do have 2 enforcement divisions. One is construction and one is general industry. I am fortunate to be the director of the construction division. I've spent 45 years around the construction industry. General industry, and so what do we cover in construction? All construction sites, asbestos work, most road work. Anything else is covered by the general industry division. And, you know, if you have questions, you can certainly contact those 2 divisions, but best place to start with is always with CET. Just so you know, some of you, this may be the first time you've heard about MIOSHA. If the 2 enforcement divisions come out, and in this case, if we get complaints or if there's a referral, we may contact you by letter. We may come out to the job site, ask some questions. If there's any violations, and in this case we're talking about the COVID requirements, there may be citations issued with penalties. And I want you to be aware of your rights as an employer to appeal those citations and penalties. First, you would go through the division, then through the division that wrote the citations, construction or general industry. Then you have the right to appeal again to the appeals division, and then there's administrative law judges that you can appeal decisions to as well. Just make sure you're reading all the material you receive, because there are deadlines, and you need to meet the deadlines to have to be able to appeal. As Deputy Director Egan said, on our website, lots of good resources that you can get, and you can contact CET, and they'll provide you with a long list of things. And there's great videos for the employers in the different industries to view. MIOSHA is also on Facebook, Twitter, and YouTube. And we also have monthly and quarterly e-news that goes out, so you can go to our website and sign up for those, and we'll send you information. And then we also have an Ask MIOSHA. Generally, we're getting answers. We get the answers back. The requirement is getting them back to you within 5 days, but most of the time we're getting them back within 1 to 2 days at the most. So feel free to use that Ask MIOSHA for questions as well. Sean mentioned earlier about the different exposure risk levels for employees. What you as an employer need to do is evaluate the risk, develop a preparedness and response plan, and their samples online, MIOSHA, and on that COVID site that was shown earlier. Designate one or more supervisors to implement, monitor, and oversee the plan. Making sure you're providing training to the employees that cover at least what are the workplace infection control practices, the proper use of PPE, steps the employee can notify the business if suspected or confirmed diagnosis of COVID-19, and how to report unsafe working conditions. And also, you want to keep records of the training for the employees. As mentioned earlier, the daily screening for each employee coming into work. If they're at home, working in home, they don't have to do the daily screening. But if they're getting out to the offices, or in MyOSHA, we have field staff that go out to job sites. They have to perform the daily screening. Records need to keep, you need to keep records of those, and that's where that symptoms app is really good. Also, you need to keep records that if an employee is identified with a confirmed case of COVID-19, immediately notify the local public health department, and within 24 hours notify the co-workers contacted the virus. Remember that information about controls.
I think everyone needs to go on mute. For anyone who just joined, please make sure your phone is on mute.
Thank you. So the first control is, engineering controls. What can be put in place, like a machine that has a hazard? Can you put a guard on it? Well, in COVID, what can you do, such as installing physical barriers? And you're seeing these pop up all over the place in retail stores. And maybe a drive-through for customer service. Then there's administrative controls. Keeping people 6 foot apart, limiting the number of in-person meetings, changing work schedules, phone-based communications, things like that. So that would be your next step. And last is the personal protective equipment. Now, in MyOSHA, we do not consider the face mask as personal protective equipment. If it's required for PPE, like a respirator, like an N95, then a face covering would not be appropriate. It'd have to be the respirator, such as the N95. Also making sure that hand hygiene and disinfection of environmental spaces, common break areas, bathrooms, etc. Also, if employees are returning to work after being ill, needs to be at least 3 days without fever, without taking medications, and 14 days since the last symptoms before returning to work. And the employer needs to assist the employee. There cannot be any ramifications for employees staying home because they've contracted the COVID virus and need to stay home. So I think I've covered the bulk of what is MyOSHA and what we're looking at. Excuse me. But I'll be around if there's any questions. So thank you for.
Thank you, Lawrence. I appreciate that. So this is the question and answer portion. I think we have maybe some people who have dialed in by phone and others by computer. So just to make sure that we don't all talk over one another, I wanted to first open up to those of you who have called in by phone for a chance to ask questions. So now would be the time just to, you can *6 to unmute your line, and if you have any questions, feel free to speak up. Okay. All right, maybe there's no questions over the phone. So any questions from our audience who joined us by computer? Again, just feel free to unmute yourself and turn on your video or not. It's up to you.
Hey, Luis, this is Bingo calling.
All right, Bing, floor is yours.
I have a question for Sean. As a business owner, we are concerned about the fact that in my industry, in the business that I own, we have followed all the CDC guidelines. We have done everything we can to protect our clients, to protect our staff. But yet the decisions that are being made by executive orders are based on a number number of people who are ignoring it because most likely for political reasons, which is causing my business to really be on the precipice of closing up. And I think there has to be some way in which we can prove on an individual basis that we can do this very safely, because we are concerned that we don't take COVID-19, we do take it seriously, and we appreciate what the governor has done. But there is coming to a point now where one portion of my business has been closed since March. And if it keeps closed for much longer, we're going to lose, 50 employees and all the investments that we have made as a family. There has to be something that can be done. For example, we do a lot of wedding receptions, and this is where families come together. This is where friends that they know come together. This is not like anybody can come in from off the streets. We have installed temperature checks. We provide masks. We provide all the things that have been asked for, but yet we are being having to suffer the consequences of some individuals, or many individuals, who are poo-pooing this thing, and a lot of it is done because of political reasons. So is there any way in which your Labor and Economic Opportunities Department can find a way to allow companies like mine to be able to survive this pandemic, and allow us to show you that we are doing the things the right way, and we are working with families? And this is, again, you're going to have families here. It's not like you're going to have everybody from off the streets coming in.
So I appreciate that, Bing, and I knew I wasn't getting off here without you asking some kind of question, but I was hoping it wouldn't be a hard one like that. I really appreciate what you're telling me. I've had several conversations with other business owners over the past, weeks on they're in a particular part of the industry or an industry, and there's some unique things about their business, and they're being lumped in with the bad actors. And there's not really a mechanism right now to sort of distinguish or differentiate between the two within the reopening plans or otherwise. So all I can tell you right now is that I truly appreciate the comments and the concern. It has been elevated. The governor is very aware that there are great business owners like yourself that are doing all of the right things, that are being impacted severely for things well out of their control. We're all being, as you know, quite impacted by something well out of our control. But I'm very grateful to hear of all the things that you're doing for your employees as well as your guests. I will take that message back with me is the only thing I can really commit to at this point, Bing.
Thank you, Sean.
Any other questions?
This is Denise from APAC, and with our community, with the ethnic community, I appreciate Sean and Lawrence sharing the information, but sometimes it's quite difficult for the ethnic community. Is it possible that we can get like a one-sheeter with the website, the number, like the phone numbers and things like that MAPAC can send out to our community and to our guests that are attending this event? I can, type it up if you like, but I just want to make sure we get it out there as soon as possible during this pandemic. Is that,
absolutely.
Okay.
Absolutely.
Yeah, just email me the information, and I would be happy just to type it up and send it out.
Yes.
Yeah.
Not a problem at all.
Yeah, I because I've been in state government, we use a lot of acronyms, and it's very confusing to the general public, because they're like, what?
Yeah. I just came to state government myself about last October, and
oh yeah,
there are thousands and thousands of them. So I'm down. I got about 5 of them down now. But yes, we'll absolutely get you. We'll absolutely get you something.
Yeah. Okay, I appreciate that, and I'm just sensitive to that for the Asian community. So
absolutely.
Yeah. Is there any other questions? If you're on the phone, press *6 and you can ask the questions.
Yep. I see someone here raising their hand, and for some reason I can't see your name, but go ahead and ask your question.
Oh, you don't read my Chinese name? I don't know why I get a Chinese name there.
It's me, I'm sorry.
No, somehow Microsoft Team automatically put my name there. I don't understand it. Anyway, I have a question to follow up with what Bingo just asked. I don't have a business, but I'm wondering, is there any probational period for business to open so that you can watch if the business is open, is following all the guidelines, doing appropriately, they can continue to open. And for those who are not, they cannot open. So I wonder, is such a probational period being established? Thank you.
Nothing of that sort exists currently, but I think it's an interesting idea. We did talk. So one of the things with MIOSHA to know is that it's about 200 people that cover about 235,000 establishments in Michigan. So obviously being in a position to sort of monitor everything across the state's a challenge. So I think that's one of the reasons you feel or see more of these blanket approaches. But no, there's nothing in place right now, but I appreciate the comment.
Can I just follow up?
Yeah.
I think as long as you're doing this, it gives me, if I'm a businessman, a good reason to enforce the guideline with the customers. I say, if you don't do that, my probational license will become useless. So that gives me some incentive, and also the customers to follow that too.
Yes, thank you.
You know, your most valuable resource as an employer is your employees. And if you have customers that are refusing to protect your employees, they're not wearing their mask, etc., then, you know, maybe you don't want them as a customer, because you don't want to be losing your employees to the COVID. Like I said, they're your most valuable resource. So, you know, maybe that helps you to let the customer know you're doing this because of your employees. You're wanting to protect them.
Any other questions? Anyone else?
I have a question. My name is Vittorio Bruni. I'm at NSI in Troy. I wonder if my name comes across in Italian. But could you give us some more information about the SB 690 COVID safety grants? Where will we be able to find it on your site on Monday?
So the site I put in the chat room, which doesn't help everybody. We'll make sure that Denise has it too, but it's the michigan.gov/COVID workplace safety. And we'll put a link right on that page to the safety grants themselves. There's a short application. I don't remember if it's just one page or two, but it's a short application. As an employer, you will have to evaluate your business to determine what needs you have for safety. It is a matching grant, so basically, you know, if you needed 200 gallons of hand sanitizer, you got to buy it and then get the money, and it's reimbursement style. And like I said, it's up to 10,000, 250 employees or less. Was there anything more, Vittorio?
No, I just need to know where to find it. I'll find the details there, right?
Yeah, and if you're signed up on, I believe MIOSHA will email it out as well once it's getting posted on their list, and you can, right on that same page, you can click on the sign up for updates. So if you'd like to do it that way, and certainly Leo will get it out on social media too.
Good, thank you.
Yeah.
Sean, this is Denise again. It's www.michigan.gov/COVID workplace safety, correct?
Yes. Yep.
Okay. I'm putting it in the chat box so everybody has that.
And as a reminder for everyone, in addition to this being live streamed, and I think we have people maybe watching it through social media, we are recording it. And so the information will be available. You can email Denise and ask for the recording. Are we going to post the recording anywhere, Denise?
Yeah, we'll be posting it on MAPAC's Facebook page.
Great.
Yeah, we'll do this right afterwards, so it'll be available. And then I'll list the site. And Lawrence, you mentioned a phone number. I'm so sorry, I was doing something else. What was the phone number for people to call?
Yeah, so that's our Consultation, Education, and Training Division.
Okay.
And that number.
Go ahead.
Do you have the number?
No, can I?
Okay. It was 517-284-7720.
IOSHA.
Consultation, Education, and Training Division.
And Denise, if folks use that 855 SAFE C19 as employees or employers, if they're employers, they'll talk with somebody, and if their questions need to, that will get them over to that Consultation, Education, and Training Division as well.
Oh.
Tashiki, is that your hand that's raised?
Yeah, thank you. Can you hear me?
Yep.
Yeah, I just wanted to thank Sean and Lawrence for super informative information that you just provided. And I live in Canton. I just wanted to give you an anecdotal story that I got my haircut for the first time last week, and everyone was behaving, wearing masks, respecting rules. And I go to local shopping, grocery store like Myers and others, and everyone's, at least where I go, they're all behaving, following rules. So there are most people following rules, I would say. And so just wanted to let you know that.
Yeah, and I appreciate that. And you just reminded me too that to Bing's question too. So one of the things that we're doing within Leo is looking for sort of best practice businesses, and Bing and yours might be one that we'd want to highlight so that we can kind of come in and show everybody like how you can do these things. Because as most of you know, a lot of it's not, I mean, it's all money, right? But a lot of it's not overly expensive or onerous, really. It's just kind of doing these few things. So you can check that out. I'll make sure I get a contact point to Denise too to send out, because I don't remember where we were sending those right off the top of my head. But we are looking for best practice cases too. So I appreciate that comment.
Hey, Sean and Lawrence. Hey, I would love to have you come and visit our center. It's not like we have a 4,000 or 5,000 square foot room. We have a 15,000 square foot room, and we have plenty of space to be able to do social distancing. We have floor plans, and so we'd love to show it to you, because I think that this industry is going to really be hurting if we don't get an opportunity. We've already canceled over 100 events. We're just not going to be able to survive canceling more. And we'd love to be able to show the government that we are able to do this thing in a very safe manner. And again, because the guest lists are going to be different. It's not just every person walking in off the street. These are friends and families that are going to be very conscientious about these kinds of things. So give me a call. I'd love to show it to you, and as a model that can be done within our industry, because we're going to need it quickly. Thank you. Okay.
Thank you. So we have just a few minutes left, and I want to be respectful of everyone's time. Are there any last questions? Either raise your hand or just go ahead and unmute yourself. Okay. Well, hearing none, this isn't the end of the conversation, even if it's the end of this particular event. As both Lawrence and Sean have indicated, there's a number of materials available. Denise will certainly be working really hard to collect that information, resources, get it to you all, and always happy to kind of keep our communication channels open, and hopefully Sean and Lawrence, if we need to do more of these, you all will graciously make yourselves available as you've done today. I personally would love to see our immigrant-owned businesses get the best businesses or best practices within the state of Michigan. So maybe that's a challenge we can put to ourselves to really highlight our businesses within our community and show the public how not only are we doing things right, but we are open for business, and it's important to support our small businesses as well during this time. So I just want to thank everyone again for joining us this morning, and thank you again to our speakers for the important information and everything you all do to keep us safe. Again, if you have follow-up questions, please feel free to go through Denise, contact me directly. We'll make sure that we get you the information that you need, connect you with people in state government that you need to be connected with, or with the resources that you need. Information is power, so please, you all are our liaisons and our ambassadors into the community, into your friends and family who own businesses, your employees, other employers that you know, so on and so forth. And please feel free to share all this information as you receive it and share it with others. Encourage people to like MAPAC's Facebook page so that they can get updates and get the information as we work with Denise and Toshiki to ensure that it gets uploaded to that page. And so I know when we asked about recording and live streaming, everyone's response was yes, share it far, share it wide. So that's what I'm going to leave you all with today. So without any last comments from Toshiki or Lawrence or Sean, anything you all want to leave everyone with?
Just thank you so much for having us. We love talking to everybody, and I can't stress enough, no shirt, no shoes, no mask, no service.
That's a perfect note to end it on. All right. Thank you, everyone. Thank you for joining.
Thank you.
Thank you.